there's nothing special or different about trans kids. There's nothing inherently wrong with trans kids, especially. Trans kids, like all kids, thrive when they are supported and affirmed. It's just kids in general need to be supported and affirmed. And we know that trans youth without supportive parents really, really harms mental health and increase the rate of suicidality.
Hello, everyone. I'm Angela Rosa DiDonato.
And I'm Marian Leary.
And you're listening to Amplify Nursing, a Penn nursing podcast supported by the Pinola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm. On this special episode of the Amplify Nursing podcast, we speak with Dallas Ducar, a nurse practitioner, activist, and the CEO of Trans Health Northampton. We talk with Dallas about her fierce advocacy speaking up for gender-affirming care for all, her journey transitioning to the person she is today, and the Arkansas House Bill 1570, signed into law earlier this month, which prohibits access to safe healthcare for transgender and non-binary minors.
So Dallas, hello. Thank you so much for coming to speak with us today.
Hello. Thank you very much for having me.
Yeah, we really appreciate it. So why don't we start by telling us a little bit about you and how you got into nursing?
Sure, I would love to. So my name is Dallas Ducar. My pronouns are she, her, and hers. I got into nursing really starting with a very different, untraditional route. I was a philosophy major, and I was a philosophy major at the University of Virginia. And while I was studying philosophy, I was studying questions of ethics, questions of metaphysics, questions, the big, sometimes boring to some people, but this stuff was really interesting to me, the big questions, right? How we live a moral life, how we know that we are conscious beings, everything from one side of the spectrum to the other. I really love these big questions, but I specifically was geared towards the kind of fundamentals too. And I was very interested in science, specifically how we know that we know stuff, getting into the scientific method. And then more specifically, I was very interested in neuroscience and the intersection between the mind and the brain and the neural stuff and how we know things. So I was very interested in this for a long time. I was studying philosophy, and I just found that my idea of what a philosophy major was and a philosophy professor was just not the same as the vision that I had. I was imagining having dialogues, outside of an ivory tower, and it just was not that way. I was imagining really a world that is kind of beyond academia. And that was not what I had encountered. Along that time, too, I found mindfulness, and I found mindfulness specifically at a school of nursing, at UVA School of Nursing. And I had a wonderful mentor who really taught in a structured setting how to regulate oneself, how to come to understanding of oneself, how to approach things with a beginner's mind, and how to recognize intention. And it was in that mindfulness class that I began to understand that there was really a chance, an opportunity to slow things down, and that had meaningful, deeply meaningful impacts on the body. I also came to understand that there was something that didn't feel really right in my own body. And that was really through the process of centering myself and really through the process of being with a teacher. And so it was through that process that I then I got to know the School of Nursing. I was still asking these big philosophical questions. I was still very much interested in neuroscience, but I also was very interested in holistic care, really recognizing the individual, from where they came from, their walks of life, everything about them, essentially. And, I was thinking about medical school at the time, but I was also thinking about nursing school. At the end of the day, I wanted to do meaningful, community-based research. I wanted to help people. And I wanted to still get to the root of some of these larger questions. And it was through that time that I became a nurse. I then went into my nurse practitioner track, focused in psychiatry, where I got to ask some of these big questions to folks every day. Why do you wake up in the morning? What's motivating you? What are your values? What are your beliefs? And in doing so, I also got to know a lot more about myself, and specifically embarked on a larger gender journey where I transitioned. I was able to finally understand and know myself as the woman I am today. And I found immense support. I was very lucky and I found immense support at our School of Nursing at the University of Virginia. Since then, I've just been so grateful to still be able to engage patients on these larger philosophical questions while also really trying to think about healing and think about care in new and novel ways. And I'm excited to continue on that journey through nursing and through some of the systems that we are trying to create here at Trans Health Northampton.
So why don't you talk a little bit more about Trans Health?
Sure, I'd be delighted to. So Trans Health Northampton is really there's a long history to it. It started with the primary funder. His name is Perry Cohen, and he was just looking for gender affirming care here in New England and really could not find a safe place, and not even just a safe place, but a place that would be affirming for him and his family. And so he became committed to trying to make sure that could happen. And there were lots of different routes that were taken, but eventually the decision was, why don't we just do this on our own? And I think there's something really beautiful to that the trans and gender diverse community has oftentimes cared for itself and really pioneered new ways of being and fighting for and establishing different types of care. In Massachusetts, 10 years ago, it was not even thought of that you could have a gender affirming surgery or a gender affirming consult or hormones, and that would be really covered by all insurers. But through the activism of the trans community, there was a lot of push to expand what is considered medically necessary. And with that came just a lot more hope that an active and informed patient population can create new metrics for care and also get that care, create new systems, really. I think we've seen that across the country. It's not just about asking about pronouns. It's not just asking about, names. It's really getting to know the individual. It's really creating an environment that is not just safe, but is affirming, that is a place where people can genuinely ask questions and can have all of their needs met in a real holistic way and be empowered. So what are we? We are, the first independent trans healthcare center in the nation. There are other FQHCs, other academic medical centers that also do provide gender affirming care, but we are the first independent trans healthcare center that focuses solely on empowering trans and gender diverse adults, children, and families. We recognize our history as a community that trans and gender diverse people have really looked to each other for healing, for support, for affirmation. And we really want to honor that by providing comprehensive and professional healthcare and really opening our doors to trans and gender diverse folks and their loved ones. So not only do we provide care, but we're also really working to provide, expert research, expert care, fierce advocacy to secure a healthy, affirming future for all of us.
Could you explain a little bit about what you mean when you say gender affirming care?
Sure, of course. So there is no definition for gender affirming care that's necessarily out there, and many people can label themselves as a gender affirming provider, which is just, some people might think they're gender affirming when they're not necessarily gender affirming. It really comes down to, is someone's view of gender expansive enough at first to be able to be open to a diverse, non-normative way of being? Can you be able to see the many different types, expressions, identities that relate to gender? So that means really not thinking in a binary way of male or female, but really thinking outside of that and really being, encompassing, being aware and being able to conceptualize people as existing in many different ways with many different identities, binary or non-binary. But what that also means too is recognizing that there are, for many people, cultural relationships to their gender. And that then also requires a level of just, understanding that people are complex and really being able to meet them with unconditional positive regard. That's really the first step. So gender affirming, on one level means creating that safe space where people can talk about gender and not fear a reaction from their clinician or provider. And then on another level, it's being able to create a space where you can be co-creative, where you and your team or your family can, creatively understand and speak about gender and not feel like you have to fit into any particular mold that's out there. It's really being able to be the author of your own experience. And that's really where we come back to this just being about patient-centered care, first and foremost. Gender-affirming care is patient-centered care. And that means listening to the patient. That means mirroring their language, paying attention, and really providing services that you have capacity for that meet the individualized needs of the patient. And while that sounds really nice and perhaps utopian, it requires a large systematic effort. You cannot just hang a shingle and say, okay, now we have the Trans Health Center. You need to have budgets committed to this. You need to have providers that are specifically committed to this. I would strongly recommend hiring from the trans and gender diverse community. And it really requires a level of deep understanding. It's not just about being nice to trans or gender diverse folks. It's about really thinking about gender in a different way and having your care reflect that, really. And so I could speak more about how, gender affirming care is patient-centered care, but I think at the very core element, it is not only respecting someone's gender, but also really being there to be able to co-create with them.
I think that's a fantastic definition. And as a clinician, I feel like most clinicians would like to think that they are respectful and being patient-centered. But I think what I gathered from what you're saying, what I'm learning from this, is that it's not just about, being respectful to the patient in front of you, but it's walking in there with this open idea of, I don't have an expectation as to what this person's gender is. I'm going to let them tell me, and I'm going to go from there.
Exactly. Yes, it's really about approaching this with a beginner's mind. And, one might say, well, you're talking about gender. Now you're talking about patients. Now you're talking about care. I thought this was just gender that we were talking about. But really, gender affirming care is patient-centered care because it benefits everyone. It opens the door to including any person's life context in that medical or clinical environment. It's more than what just happens in the clinic. It's the process of caring for every part of one's life that intersects with gender. And that doesn't just include the clinic or the care facility. It's, gender identity is deeply ingrained in part of who we are, impacting us in bathrooms, in workplaces, in schools, in many, many different settings. It really involves caring for the whole person. It really means we're going to care for one's identity. And that requires the healthcare system to be responsive to someone's identity, right? And that is a very different ask than just being responsive to a specific subspecialty, making sure that we are, that blood pressures are all, within certain limits. This is now expanding our notion of identity and ensuring that we are approaching others' identities with a beginner's mind.
Yeah, I think that's definitely a very novel approach for many people. I think that it's a great start, and I think that there's a lot of learning and thought that needs to go into it, and a lot of training for people in the clinical space.
And I might just mention too, it's a lot of training, and it really did not happen overnight. 15 years ago, we did a very different healthcare framework. In the 80s, Medicare barred coverage for gender affirming surgeries and private insurers. Whereas jump ahead 20 years later, in around 2005, California, had prohibited health plans from discriminating based on gender identity or expression. But that's not everywhere. And, the ACA had banned discrimination based on sex, and that can be interpreted as gender, and it was in 2010. And then, HHS is still, had to lift a ban on gender identity. And then, federally assisted insurance plans also had to remove exclusions for gender affirming care. So there are a lot of system-wide downstream effects, whether it's the EMR, whether it's signage, whether it's how we assess a patient, whether we think they could be pregnant or not, whether we think they could have an organ or not. I mean, this really has, based on how we approach care and how we see individuals' identities, it has really profound downstream effects in the clinical care that we provide.
Looking at what's going on across the country, there's some legislation going on specifically in Arkansas and also in other states that is prohibiting treatment for trans minors. Would you like to talk to us about that a little bit?
Sure. So I would first and foremost say that our country is really in the midst of an unprecedented wave of state level legislation seeking to block, youth from accessing life-saving healthcare. Gender affirming care is life-saving healthcare. Hormones are life-saving, surgeries are life-saving, and, just the ability to speak about gender is life-saving. And unfortunately, yes, this was Arkansas recently moved ahead, the legislature did. We just know that these medical ban bills are just really, really detrimental to youth and to the trans community. And they have myths that are just baked into them. They claim that gender affirming care is experimental. That's really at the core of Arkansas's bill, HB 1570. And, there's been folks that have described it as at best experimental and at worst a serious threat to a child's welfare. And that's just not true. We have, clinical care for trans youth that's grounded in longitudinal data and spans decades across the world. Internationally, gender clinics have been doing this work. And, we have historical evidence of kids transitioning sooner than the word transgender was even used. Back in the 50s, the 30s, we have evidence from the 1800s and even before that too. So we know that this is not a fad. We also know that this is not experimental. When it comes to things like pubertal suppression, this is a treatment that's deemed safe for cisgender boys, cisgender girls, and it leads to decreased suicidal ideation in trans youth. Additionally, we have a ton of research that demonstrates improved quality of life after receiving gender affirming care for those specifically who would want it. We're not forcing this on anyone. This is just about providing a life-saving type of care. We know also that there are myths out there, especially baked into this legislation, that gender affirming care is just too available. That's not the case. We don't just hand out prescriptions for gender-related medications. in reality, we're providing therapies for trans youth after a lot of consideration. As we talked about just earlier in this podcast, gender affirming care is really multi-leveled, holistic, patient-centered care. And we're thinking about this from a medical perspective, from a mental health perspective. Medications are only provided after it's been determined that the child has consistent gender identity that really does not align with their sex assigned at birth. And only after there's been a thorough discussion around risks and benefits. It's also highly individualized. And in many cases, trans kids actually don't end up receiving medications related to gender because that's not what they want. So this is really, really insidious legislation that is limiting the type of care that anyone can provide, a provider, a clinician, a nurse, anyone. There's also this claim that these bills are protecting youth, when that's just not true. Many youth still will seek treatment in very unsafe ways, like obtaining hormones through black market means, sometimes using online platforms to get advice on dosing. Just because you ban something, it does not mean that it's actually going to succeed in preventing that from happening. We've seen that in so many different areas in society. We really instead need to be focusing on how to provide more access. It's already very difficult to access. There's lots of, there's just a limited availability of local clinics. There's insurance restrictions. There's nothing special or different about trans kids. There's nothing inherently wrong with trans kids, especially. Trans kids, like all kids, thrive when they are supported and affirmed. It's just kids in general need to be supported and affirmed. And we know that trans youth without supportive parents really, really harms mental health and increase the rate of suicidality, which makes this a life or death issue. And these efforts undermine access to healthcare. Especially in a pandemic, but this is scientifically rigorous healthcare. And these kids should instead be worrying about, their friends, sports, school, and not whether these elected officials are going to undermine their ability to exist. It's just clearly an overreach by the state to be getting involved in these individuals' care. And even Asa Hutchinson, who is the governor of Arkansas and vetoed the bill, he had specifically spoke as to why this was an overreach of the state and how this was the state getting involved in between the deliberate choices between patients, families, and providers. So, I could go on about this, but this is just really, really bizarre. It's bizarre, especially when Republicans have been so against state regulations in the time of COVID, and yet are now imposing restrictions on healthcare at the same time. And I think really many people clearly see this for what it is. It is an attempt to get more votes and to stir fear. Trans kids make up less the population than left-handed individuals in the United States or redheads. And so why are we having this conversation? It's because the GOP in those states is trying to create a flashpoint around a problem that just doesn't exist.
I completely agree with you. It doesn't really make any sense at all from even just a logistical standpoint, taking out even the controversy that they're trying to create around trans people to try and legislate anyone's access to medical care. Even if it worked for 99% of the people, there's always going to be that one person that the rule needs to be different in order for them to thrive. And it just doesn't make sense on so many levels. Would you be able to talk to us a little bit about what it was like for you to transition and how much harder it would have been for you had a bill like this been in effect when you were trying to transition?
Well, thank you. I'd be happy to talk about it. I will say that when I started transitioning, I was actually of the age of majority. So I could actually consent to my own treatments. But I will say that, when I had initially transitioned, I did wait until I was able to not only make my own decisions as an adult, but also know that I would be able to afford gender affirming care. At the time, I mean, I remember when I was a kid, I looked up how much gender affirming care would cost, how much surgeries might cost or medications might cost. And it required then me to have a conversation with my parents that I just didn't want to have when I was a kid. And it required me to, there was no way for me to even begin to explore gender identity without also thinking about exploring that with my parents as a kid. And I did not have a space that felt safe to do that. And so I waited and I pushed it down. And I think that's what, there's a lot of folks out there, I think, that will push their own dysphoria down just to get through. I'd like to change the conversation, though, around that. I think that's what I call a trans superpower. That is, the ability for somebody to push through dysphoria, to actually be able to thrive, to be able to compartmentalize some things that might need to be compartmentalized at different times. That is a trans superpower. There are so many ways in which trans folks have been resilient in the face of a government that is opposed to their very existence, resilient as opposed to systems that are just not designed with them in mind. They are designed with white cisgender men in mind, and have been really vocal in being true to who they are as a community. And so I think that just really demonstrates the immense power that trans youth have. And for me, I survived, which not, I was privileged in some of the access to resources I had. And I also just really bared down and knew that I would not be able to transition as a child as much as I wanted to. What that did mean is that I found healthcare services at the University of Virginia when I was in college. And it was only because in a nursing class as a nursing student, there was a group of students that were doing a presentation on gender affirming care. And according to my professor that day, my eyes were just lit up. And I was the most engaged that I had ever been in class. And I wanted to know everything about gender affirming care. I don't really remember that day as maybe vividly as that professor did, but I think she really saw something in my reaction then. Regardless, I was able to, transition at the university through their teen and young adult health program, which I eventually helped to provide some mental health services there as a student, and think about what their workflows would look like for mental health in a primary care setting. That still required me at the time, as an adult, to get a referral letter from a mental health provider, which I will 100% say is gatekeeping. We shouldn't be pathologizing someone's identity. We shouldn't be saying that someone has to go see a mental health provider to get a verification that they are actually a certain type of identity. That is just wrong on many levels. And at that time, though, it was my only access. So I didn't know any better. I would say, though, if we go back to that time and if Virginia had also implemented a medical ban, it's very likely that I would not have, especially if I was a child at that time, I just would not have had any ability to be myself. And, kids are resourceful. I probably would have turned to other means. The mental health effects would have been deleterious. It's just a really inhumane piece of legislation. And my hope is that the ACLU and other organizations are effective in challenging the legislation, because the effects that this would have on a very small portion of the population are tremendous. It's just really, really terrifying. And that's why I see organizations like Trans Health Northampton as hopefully a new hope, as a way to begin to focus on what is beautiful about being trans, what is remarkable about being trans, really, really focusing on what is right with trans individuals of all ages, and in learning from the trans community, not, just moving forward this narrative that trans identities should be pathologized. I also just see tremendous benefit in institutionally, financially putting all of the resources behind a gender affirming care center. Because I think what that does is it says when budgets are tight, gender affirming care is never going to get any less of the pie, because we are fully committed to gender affirming care first and foremost. And I think the more organizations we start to see that are, comprehensive, independent gender affirming centers that are standing out as organizations committed to this type of work, the more difficult it will be to roll back any of the progress that has been made, because you'll have, your feet really planted in the ground as an organization. I think the more we start to see training programs, whether, nurse residencies, physician residencies, APP residencies, whatever it may be, the more we start to see those formal programs, the more we start to see informal programs, the more we start to see pipelines that are dedicated to this work, the more we will be assured that there's just no way to roll back gender affirming care and the progress that we've made. But what that also takes is really focusing resources in places where gender affirming care is threatened. And that especially means, supporting efforts in places like Arkansas.
How do you see the role of nursing in supporting gender affirming care?
I see nursing as a leader in this area. Nurses are taught from the very first day to be holistic. We are also taught that we are the number one trusted profession, and we take a lot of pride in that. We also are a discipline that, and a profession that really is very patient facing, whatever the subspecialty might be. And so as nurses, you are, constantly using your hands or using your presence, or, really taught to be there with the patient, to have compassion. And, going back to the root of the word compassion, to be with suffering, the root of the word patient also comes from suffering. And so it's being with one who's suffering and really alleviating that suffering too. And for nurses, that requires being holistic and seeing gender identity, gender expression, different ways of being, different sexual orientations, really understanding the context of the individual, knowing that bodies can look differently and, really celebrating that. And then also nurses need to be able to be trusted and create that trust, that atmosphere of trust with the patient. That trust is essential to gender affirming care. It is using the right language. It is approaching this type of care with an expansive mentality. It is, not really focusing so much on the clinical interventions, but instead being able to have conversations outside of that. When I was a psychiatric nurse on inpatient unit, we actually had a patient come back and talk to us about what made them feel the most safe when they were on this inpatient unit. And, so much of our interventions had been about, locked doors, specific policies, procedures, the stuff that we thought was really important, but also maybe a little boring at some times. And this patient said, what really made me feel safe was a feeling of trust. And I felt that I could actually trust the custodian the most, because he would sit down and he would play chess with this patient. And it was that simple act of kind of going outside of assuredly this custodian's job description and playing chess with the patient that made the patient feel seen, that made the patient feel that there was that they could trust others in the environment. And that's really where I think nursing can excel. It is because you are so patient facing, because you are able to be with someone, whether it's during their suffering or their joys, because you're able to be there with a compassionate presence, there's so many opportunities to be gender affirming. They're just all over, and it's about creating that culture of trust. And when you're able to be there with the patient time and time again, there are so many opportunities to create trust.
Well, thank you so much for your time today. I really appreciate it. Is there anything else you would like to touch on before we go?
For anyone listening out there, whether you are in healthcare, whether you are a nurse specifically, whether you're not, there are many, many opportunities to learn from this work. And you don't need to be a specific clinic dedicated to this to really be able to learn from this work. We are all attempting to achieve what might seem impossible at times, which is restoring faith in humanity in the larger broken system that is the American healthcare system. And we have ways that we can do this, whether it's through robust clinical education, whether it is through the services we provide, but we all are trying to, at the end of the day, create a space that allows patients to show up and be themselves and clinicians show up and be themselves. And when it comes down to it, that is, I think, a recipe to reduce burnout. When you're able to create a space where folks can authentically be themselves. So when it comes back to Republicans across the country that are trying to introduce different legislation, trying to ban gender affirming care, I think the dialogue really needs to be focused on, actually, no, trans folks are vastly improving the American healthcare system. We should celebrate the expansion of gender affirming care as a victory, that this is really about patient-centered care. We are able to learn lessons from the trans community on how to really provide participatory, active, authentic, and holistic care. And anyone can integrate that into their own practice. You don't have to be any type of gender specialist. This is really just about returning to the basics of healthcare and putting patients first.
I think that was beautifully said. Thank you.
Thank you.
Hello, Marion.
Hello, Angela. How's it going?
It's amazing. We just had a fantastic conversation with Dallas Ducar. She is a wonderful trans activist. It was an incredibly engaging conversation. I'm really excited for people to hear it.
She is doing just incredible work and really needed work for the trans community.
Yeah, I'm excited for people to hear this interview and to hear her talk about the importance of gender affirming care and the role that nurses can play in bringing these trans issues to the forefront.
Yeah, and also making sure to highlight why the Arkansas Bill 1570 that just passed earlier this month is so detrimental to transgender and non-binary minors. This is something that we as healthcare providers really need to be aware of and need to be speaking out against, in my opinion.
Yeah, no, I completely agree. I don't think it's a great idea to restrict access to medical care at all for any reason. We kind of talked about offline that, even if you argue that it's good for most people, there's always going to be somebody who falls through that gap who this care is so incredibly important. So the logic just isn't there. If you even take out the controversy, I can't even believe there's a controversy surrounding, someone's own personal identity. But even if you take that controversy out of it, it still doesn't make sense. You wouldn't want to restrict anyone to getting access to what they need.
Right. And what she said, it's life-saving care for transgender and non-binary youth. And as healthcare providers, we have an obligation to provide life-saving care whenever needed. no matter who it's for.
Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary, and produced by the University of Pennsylvania School of Nursing, with special thanks to our Department of Information Technology Services for their assistance. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through. We want to thank you for listening to the Amplify Nursing podcast and remind you to subscribe to the podcast on iTunes, Spotify, Google Play, iHeartRadio, or wherever you enjoy your podcast listening. And if you can, please do us a solid and rate and review us as well. It will go a long way in amplifying our episodes.